Today we're going to be talking about managing pain and discomfort. Although I'll use the term pain often, really any physical discomfort. It could be post-concussive symptoms that persist for a long time, even after the initial concussion or brain injury occurred. It could be emotional distress, general unease in the body. It could be lack of sleep, leads to achiness in the body, all sorts of things. Many veterans have actual physical pain due to nerve damage or other head pain, etc. But whatever I talk about in terms of pain also relates to general physical discomfort. I'm going to do an exercise right now to help us so we don't react as strongly to the discomfort. Sitting in your chair, and you can have your eyes open. It helps you engage where you are. If you'd rather, you can close your eyes for this exercise. And first start paying attention to what's in front of you, what you see, what you hear, and comfortable sensations such as the air touching your nose or skin, your feet on the ground. In other words, immerse yourself in the sensations that are present. You might notice sounds around you. Other people, a clock ticking, traffic going by. You can notice those sounds, and you don't have to react to them. Just simply be aware of them and let them be. Notice them off in the distance. You don't have to judge them, like them or dislike them, label them. Simply be aware of them. As you sit here, breathing in and out, noticing what you see, just be aware of those sounds off in the distance. And then you can bring your attention back from what you're aware of out there to what you see right in front of you. And engross yourself in what you see. Look at every texture, color, shade, every detail. If you find that your mind gets pulled away, notice what pulls it. Simply observe it as if it's that sound off in the distance. Observe it without getting involved with it. Just simply notice that thing that distracted you. Let it go. And return to absorbing yourself into what you see. Notice the weight of your feet on the floor. You don't have to change your feet, just simply notice it. What part of your foot is touching, more or less? What are the sensations in the bottom of your foot? Just being aware of those sensations. Place your hands over your lower abdomen. Feel the way the warmth of your belly, the warmth of your hands rocks forward and back. There are many things to pay attention to. You can control what you pay attention to. Those sounds off in the distance, you can notice them. You don't have to react to them. You can let them be. And then you can bring your attention back to what you see, or what you feel here at your abdomen. You can notice the sensations on the bottom of your foot, simply being aware of them without changing anything, without liking or disliking, pushing or pulling, simply being aware of it. Let it be there. And then bring your attention back to the warmth at your belly, floating forward and back. And the same skill can be applied to discomfort. Notice some area of your body that's uncomfortable. Simply notice it. Be aware of it without tensing or pushing or pulling or labeling. Just simply being aware of it. Same way that you are of sounds off in the distance. Same way as you are of what you see in front of you. Be aware of the sensation in your body. Allow it to be there. Without stopping it, wishing it was different, tensing against it. Just simply allow it to be there. And then bring your attention back to what you see in front of you, and the breath flowing forward and back from your belly. Drinking that breath in through your nose, down into your belly, getting warmer, and flowing out from your nose. Anytime discomfort pulls your attention to it, notice it without changing it. Just simply be aware of it, as if it's out there in the distance. It can be there just like those sounds are there off in the distance, but you don't need to pay attention to it. You can recognize it, allow it to be there, and then bring your attention back to what you see, what you hear, and this soothing breath flowing in and out. Maybe that discomfort remains as part of your consciousness. Perhaps it's 50% of your awareness. That's okay. It can be there. You can let the discomfort be there. You don't have to react to it. You don't have to pursue it. You can simply notice it, allow it to be there, and then bring your attention back, absorbing yourself fully in what you see, hear, and this soothing breath flowing in and out. Getting warmed by your body, flowing out gently and warmly. Take a few minutes now and practice that mindful awareness on your own. Absorbing yourself in what you see, hear, breathing in what you see and hear. And when your attention gets pulled by some discomfort, simply notice that discomfort, notice that sensation. Try not to label it, react to it in any way. Simply allow it to be there, recognize it, be aware of it, until it has no power over you. It's just there. Just like a sound off in the distance. It's just there, off in your distance. And you, your core,
I'd like us to turn to some self-help exercises now that we're going to cover a variety of them, and some of them will probably be very helpful for you. Here's one that's helpful for most people. So please sit back. You can have your eyes closed or open and looking downward. Place your hands on your abdomen. Take a deep breath in, and then let it go, and feel your breathing. Notice your pain. Where is it? Describe it in some detail to yourself. Is it hot or cold? Sharp, radiating, throbbing? Is it fixed in one place? What's it like? And then label it on a scale of 1 to 10. How would you rate its intensity, with 10 being the very worst possible and 0 being nothing at all? Now find a place in your body, not too far away from that other place, where there is no pain, no discomfort. Describe that area in detail. Sometimes we only focus on the distress, the distressing thoughts, the distressing feelings, how miserable we are because of what's going on. It's nice to know that there's other areas of our body that we can also focus on that's different, that's actually positive, or at least neutral. Now focus on something you see. If your eyes are closed, we'll look at the light patterns behind your eyelids. If your eyes are open, then notice what you see right in front of you. Describe it to yourself in every detail you can. You don't have to describe what you like or dislike about it. Just notice the textures, the colors, the patterns. Now focus on something you hear. And you can describe that in every detail. Just like you're going to report on it in a minute, so that anyone who heard that description could really understand it and reproduce it. Now focus on one thing you feel against your skin. Could be the air, it could be the pressure of the chair or the bed, feet on the ground, the body expanding and releasing with every breath. Just focus on one thing. And describe that as if you had to describe to someone else so they could understand what that sensation is like. How would you describe it to them? Now absorb yourself in what you see, what you hear, and the feeling against your skin. Absorb yourself in that as fully as possible. And when you're focusing on these other things, how much of your awareness was on the discomfort or pain? Here's what I'd like you to do. As you're focusing on what you see and what you hear and what you feel against your skin, notice if your attention gets pulled to the discomfort. Let it be there without reacting to it. Just notice how your attention has been pulled. Notice that discomfort. Then shift your attention to what you see, hear, and feel in this moment, in this room. Some people find it beneficial to feel as if they're breathing in what they see, sucking that in till it's in the middle of them, filling them. And then when they exhale, they pour the breath out into what they see. And the same with what they hear. Feel as if you're breathing in what you hear, pulling that into the middle of your mind, and then pouring your breath out to what you hear. So feel as if you're breathing in what you see, hear, and feel into your lungs, into your body, and then breathing out any discomfort into what you see, hear, and feel. Just let that pour out through the breath. Feel the breath flowing into that area of discomfort, and then let the discomfort flow out through the breath into what you see, hear, and feel. Almost as if you're massaging that part of your body and releasing it with the breath. Take a moment to do that on your own. And if you find yourself starting to space out and drift off, that's okay, just notice that. And then bring your attention back to the breath, letting the breath and everything you see or feel or hear flow in with that breath into that area of discomfort in your body. And then let that area of discomfort flow out through the breath, back into what you see, hear, and feel. The breath flowing into that part of your body and flowing out, like massage from the inside. And you can practice this anytime. You can practice that with your eyes open, or you can practice it when you're going to bed, or if you wake up in the middle of the night feeling discomfort. First focus on what you see, absorb yourself in what you see, then what you hear, then the feeling of sensation against your skin, and then try and be totally absorbed in just what you see, hear, and feel. Notice how your mind gets pulled back to discomfort. And you can notice that, but then bring your mind back to the breath flowing in and out, as we just did. But next, I'd like you to do a certain exercise on paper. Or, if you don't have paper nearby, then just do this in your mind. Think of a few ideas that makes the pain worse. What are some external factors? The weather, your boss, your spouse from time to time, doing physical exercise, getting injections. What are some things that could happen that would lead to your pain getting worse? And what internal factors could make the pain worse? Maybe things like poor sleep, anger, stress, focusing too much on it, lifting something heavy. Think of it this way. If tomorrow you wanted to show me the worst pain that you have, what would you have to do today or tonight for it to get that bad? Make a list. What type of things would you do between now and then to ensure that your pain would be as bad as it could possibly get? And again, by pain I also mean any physical discomfort. And either write those things down on paper or think about them in your mind. And now, a new list. Think about what type of things make it better. What external factors might improve the situation? For example, when you get a massage or injections, when someone is being nice to you, when the weather is a certain way, etc. What internal things help make it better, like getting decent sleep, taking a day off from work, stretching, doing this breathing meditation we did before, etc. In other words, what can you do that minimizes the distress or the pain and improves your experience? So again, think of it as if tomorrow you wanted to show me the least pain you could be in, what would you need to do today or tonight to maximize your chances of feeling the best you could? And here I don't mean taking medicines or necessarily getting injections or anything medical, but what can you do in your lifestyle, in your mind? So go ahead and make that list. So you see, we have a measure of control over our discomfort. And there's also factors we can't control very well. We have to appreciate both, and especially focus on those things that we can control. Let's continue with other factors that influence our experience of pain and our reactions to it. Negative emotions such as anger, depression, anxiety, all exacerbate the sensation of pain. And also our feelings of disability associated with it. Trying to get control over stress and anger can help reduce the sensation of discomfort in our body, as well as feeling overwhelmed and out of control. So getting control over stress and anger can help reduce these negative outcomes. If you think there's nothing I can do, you're going to feel miserable. There are always things that can be done. People can manage cancer pain or phantom limb pain. There's always self-help techniques that can reduce your pain by 50% and often even more. So there's always something that can be done to help manage and control the suffering and the sensation and the reaction to the nerve, even if you can't control the nerve sensation itself. Think about this. How much do your thoughts and emotions influence the pain? Do you feel like you're largely in control or largely out of control? On a scale of, let's say, 0 to 100, with 100 being totally in control and 0 being totally out of control, how much control do you feel you have over your ability to control your focus on activities you're engaging in? And in the same way, how much do you focus on the pain so that it distracts you from your daily activities? Not at all? Maybe 0? Or do you think the pain is distracting you, that your attention gets pulled to the pain 100% of the time? So think about how much of the day do you focus on the pain so much that it distracts you from your daily activities? And does this focus on the pain make you think negatively about your life, about the future? Do you avoid social activities with others or become irritable with loved ones? To what extent does this really control your thinking? How much does it lead to avoiding activities with others? 0%, 100%, or somewhere in between? There's a range of ways to cope with discomfort, and neither extreme is very helpful. You can become too passive, there's nothing I can do, or too active. I should be able to control every aspect of all aspects of my life, even if it makes myself and others crazy trying to do that. That's clearly not a good extreme. There's a healthy degree where you can control some aspects of your life, but you just have to let go of others. Especially if there's nothing you can do about it right now. Where do you focus blame and control for your problems or your discomfort? Do you focus externally for blaming others for your problems and also look to others to correct your problems? Or do you blame problems on yourself because of what someone else did to you? Do you blame yourself for not being able to control it better? There's a range. If you focus totally on others, then you'll be relying on others for a long time, blaming them or expecting them to help you, and unfortunately you'll always be disappointed with the results. On the other hand, if you're totally self-responsible, if you blame yourself completely for what happened, how you got here, and you're totally responsible for then improving yourself, you'll also be equally disappointed. We need some external support sometimes, but we also need to rely on ourselves to a good extent to improve things. So where's your balance in that? Do you tend to focus on others for causing your problems or being responsible for improving your situation? Do you focus on yourself for your problems and also correcting your situation? And how balanced are you with that? You need that balance between realizing you can get better, but not getting too distressed when it takes a little dip in your progress and you're set back. It's important to be optimistic, but not unrealistically optimistic. Do you believe that pain is something that's fixed and there's nothing you can do about it? Or do you understand that you can make changes with regard to the pain sensation? But still appreciate that no matter what you do, there's going to be some degree of discomfort if your pain is chronic. Everyone has discomfort from time to time, some people more than others. We need support from others, but not too much support. We need to pay attention to our discomfort from time to time so that we can act to improve it, or to take stock so we aren't aggravating it. But we shouldn't pay attention to it all the time. So again, we have to find a balance in all these types of coping. It's also important to develop clear goals and set realistic expectations. A realistic expectation is to reduce pain by about 50% and reduce our reactivity to it. Excessive reactions can exacerbate it by 75 or sometimes up to 100%. It's important to improve functioning in various areas. Perhaps we want to obtain these goals by 6 months. You might say, in 6 months I want to be doing this meditation practice every day, going to yoga classes twice a week, getting regular sleep, going to physical therapy, or whatever it's going to be for your goals. Whatever goals you set for yourself, you want to set them realistically. So I want you to take some time now and set some realistic expectations that you can discuss later with others, or be able to go back and focus on, and how you're going to improve your physical discomfort. Realize that you may want medical support, but you want to reduce things like short-term opiates, short-term narcotics. You may want to reduce muscle relaxants, alcohol, artificial sleep aids. They might give you temporary relief, but in the long run you're going to want to reduce these things so you can rely on healthy self-help skills that won't interfere with sleep or energy or mood, but actually improve your mood and other factors. Self-help never interferes with sleep or energy. So think of what things you maybe want to get rid of in the next 3 or 6 months and what new skills you want to adopt. That's realistic, that you can really achieve. Ideally, a lifestyle modification that you can adopt and utilize every single day for the rest of your life. That means doing some stretching. That's something you can do every day and should do for the rest of your life. If it's sitting down in a chair and doing some breathing exercises, then that's a healthy thing to do, and you need to build that into your life structure, into your daily schedule. But equally important with setting these goals is think about what might sabotage you implementing your healthy goals. What external factors might sabotage that? The kids, the rain. If you say, I'm going to go out walking every day, but then it starts raining, and you can't walk in the rain, well, what alternatives can you have? What can you do to overcome these obstacles? There are a number of self-help mental exercises that you can do as well. We did some earlier. You know, the various relaxations and meditations we've been doing, attentional exercises. Those can reduce the psychophysical stress and improve sleep. So if you do these just before you go to sleep, or if you wake up in the middle of the night, those can be very useful. But there's also a very nice self-hypnosis exercise that I'll lead you through right now that you might find helpful. So sit back. When you're settled, either lying on your bed or sitting back in a chair, I want you to squeeze your fists very tightly. Raise and squeeze your shoulders. Squeeze your eyes shut. Take a deep breath in and hold it. Hold it, squeezing, hold the breath, and then release. Release everything. And as you release, feel as if you're relaxing your body into the chair. And you can relax your breath into your body. And relax your mind into your breath. As if your mind is floating and relaxing down through your body, comfortably, safely, and easily. And as your body and mind continue to relax here, I'd like you to focus on your discomfort for a moment. Notice that discomfort, where it is and where it isn't. If the discomfort was a color, what color would it be? Make that color a little brighter, a little richer. Make it more intense slightly. If it was on a scale of 1 to 10, make it about 2 points more. And now start to let it fade. Let it fade further and further. Let it flow out of your body. When that color seems not to be fading anymore, then go ahead and increase it slightly, maybe 1 degree more. Let it build, build, and then let it fade again. And this time let it fade even further. It leaves your body in some way, or maybe it just reduces its intensity somehow, becoming lighter, softer. And as that color continues to fade, now go to another place in your body that feels comfortable, at least neutral, but hopefully comfortable. If that comfortable area was a color, what color would it be? And now build that color. Let it enhance slightly more. Let it build, fill you. And now let that nice color, that comfortable color, start spreading through your body, soothing you, easing you, comforting you. And also spreading toward that other color, hovering around that other color, staying around it, moving around it, circling it. And in a moment, I'm going to ask them to merge. And now, let that new color merge with the other color, blending with it, changing it right through its core of that color, all the way through. Blending, merging, mixing. And then let that new color, that new blended color, start to fade and flow out of your body. Good. So go ahead and open your eyes. Remember, it's important not only to focus on the discomfort in your body or just one painful area of your body, and not just to label it the same way or think about it in the same way. That's really just something we're doing with our mind, picturing the pain or discomfort in a certain way, and then it becomes fixed. So this exercise we just did can help shift that fixed habit image. And interestingly, many people find that their sensation of pain is greatly reduced after doing that exercise. Other people find that this type of exercise helps when they're feeling a lot of discomfort, especially lying in bed. Some people can imagine something off in the distance, a sound, a sawmill, or someone cutting up trees, or a crow crowing off in the distance. And when the comfort is more intense, they just let that sound become more intense off in the distance, picturing it out there in the distance. And then they can start to imagine making that sound softer and quieter. Sometimes it even helps to put a filter between that distress off in the distance and their awareness here at their core of their body, the center of their body. So that you can notice that it's uncomfortable out there in the distance, but you don't have to let it bother you here at your core. Instead, you can feel in the core of your body the warmth, the breath flowing in and out effortlessly, the body expanding and releasing. This is your core. This is what you always have, but you have to pay attention to that as well. The more you focus on this soothing breath, the warmth of your body, the body expanding and releasing, and imagine that discomfort more off in the distance. It's there, but you don't have to react to it. You can put a filter between you noticing it out there and feeling it here. You don't have to react to it here at your core. You can simply bring your attention back to this core, this natural fundamental feeling. So we did several different exercises, self-help pain management exercises, that hopefully one of those or more can be useful to you. Like any exercise, you have to practice them to feel better with them. So find an exercise that works best for you and try and practice it several times a day. The main practice, though, that you can do throughout the day, during your waking hours and also when you're lying in bed at night, is to notice the discomfort, but you don't need to react to it. You can notice it there, but you don't have to tense against it, focus on it, worry about it. You can just let the breath breathe you. Absorb your mind and attention into what you see and hear around you and the feeling of the breath. At the very least, you won't be reacting to the discomfort as much. So take some time now, go over what you've written or thought about, and think about what you can do in your life to improve your situation with regard to the discomfort? What one or two things can you do where you can increase your control over your discomfort, whether that's doing something with your mind or your body, avoiding those situations that exacerbate the pain, engaging in those things that help more? What might sabotage you in implementing these, and what can you do to overcome those obstacles? I'm going to give a brief presentation of pain and somatic or body discomfort, how to understand this discomfort better, and how to manage it. I'll start with a brief lecture of principles in general for improving pain and body discomfort, and then we'll go into some experiential exercises, some of which I'd like for you to write down so you can think about ways you can tailor these principles for your particular life, and then others which we can experience through individual practice during this session. Then you'll have a chance to think about how you can implement these changes in your life. Of course, people who have significant pain or other body distress can go to a doctor and seek help, and that can be useful. But really the first line of defense is self-help methods, especially with pain and physical discomfort. It can help prevent and manage acute pain and also manage chronic pain and discomfort. No pain management intervention, whether it's medical or self-help, will work for everybody every time, and nothing is 100% effective all the time. A realistic goal for pain and discomfort management is to find methods that help you to reduce discomfort at least 50%, and ideally reduce suffering and distraction due to that discomfort by at least 75%. Pain is different from other medical conditions. If you have a heart attack or cancer, you have those things whether you're aware of them or not. But pain is a conscious experience. If we have a compressed disc and we're asleep, we're not in pain. We might still have nerve damage, but we're not experiencing pain. We can attempt medical treatment or physical therapy for improving the cause of pain, and we can use self-help methods to reduce the experience of the pain and the distraction and suffering that go along with that. Let's discuss for a moment what comprises our conscious experience of discomfort. The nerve signaling to our sensory cortex and our awareness being brought to the sensation contribute to our experience. But our reaction to the sensation is another very important contribution to overall discomfort. Our reactions include our attention to the sensation, our interpretation, our emotions, the sleep disruptions we have, how we react around others or at work, etc. These all contribute to our conscious experience of pain and the extent to which we actually feel or rate this discomfort. The more we can control our reactions to the pain, the less will be our experience of the pain, and our suffering due to that discomfort will also be reduced. Again, there's the nerve stimulation itself, but then there's a reaction to that nerve stimulation, and both contribute to our experience. We do everything we can to reduce that neurostimulation, that nerve irritation. We go to a doctor, we do physical therapy, stretching, whatever it takes. That's healthy, and that's fine for us to do. But at some point, we need to work with what we can to reduce our reactivity to that nerve stimulation as well. That's something we can have complete control over. You may not be able to reduce the nerve stimulation any more than you've already done receiving help from docs or medication or stretching, but you can very much continue to reduce the negative reactions that we have. That's where you can use your self-help skills that we're going to be learning here to reduce the suffering due to the discomfort and actually reduce the experience of the pain. So again, just to bring this home, pain is a conscious experience comprised of the nerves being stimulated, our physical reactivity to it, that is when we tense up against something, our emotional reactivity, that is how distressed that makes us, attention to the pain. The more we pay attention to it, the bigger it becomes and the more it's a part of our lives. Meaning, that is the meaning we give to the pain, what it implies for us. Our coping styles, how we react, what's our unique way that we react to it or deal with it. And the social influences that we have, what it means to others and what it means to ourselves to interact with others. Let's focus on the attention we give to the discomfort again for just a moment. Remember the principles of attention. First, whatever we attend to, we enhance that thing. Whatever we attend to, our bodies and brain responds to it. So if you focus on pain, the pain can increase by typically 50%. It actually feels 50% worse. If you focus on what's in front of you or on your breath at night, the experience of pain typically reduces by 50%. There's a cartoon where Marmaduke's mom is saying to her husband, as he's being dragged along the ground by Marmaduke, the dog, "Have you ever thought about just letting go?" Well, that would be obvious, but it's hard to let go of discomfort. It's just like post-traumatic stress disorder. It's hard to let go of the thoughts that worry us. With physical discomfort, it's hard to just let that go. We want to pay attention to things that distress us so we can be aware of them, try and figure out what's going on. But the more we pay attention to them, the more they distress us, the bigger that experience becomes. Now let's talk about meaning for a moment. The meaning we attribute to pain influences our experience of pain. A stubbed toe versus the toe bleeding after an accident, for example. Or our hip hurts after a workout compared to our hip hurting after a diagnosis of cancer. The same nerve stimulation might be sent to our brain, but we have very many different interpretations depending on the situation, and so we have a different experience of the pain. I've seen this many times in my own life and in thousands of patients I've worked with who have discomfort. If they're cardiac patients and have chest pain, they'll focus on that pain and interpret it as being, and rightfully, potentially horrible. As soon as they find out that it was just a rib that was displaced and that their heart is fine, the sensation is reduced maybe from an 8 all the way down to a 2, really in minutes. The same with cancer patients. Suddenly their hip hurts and they're very worried about that, understandably. And so they go and get it imaged, and it turns out to be fine, maybe it was a little arthritis, and almost immediately after, their pain is drastically reduced. So the meaning we attribute to our sensation can lead to a much greater or much less sensation of pain and discomfort. There's another cartoon where the mother is telling the daughter, "Don't tell me that worrying doesn't do anything good. I know better. In fact, 99% of the things I worry about never happen." So this is very true with people who have anxiety disorders or post-traumatic stress disorder, but also pain disorders. Sometimes we think the more we pay attention to it, the more we worry about something, the better we'll be able to manage it or deal with it. But that's not necessarily true. We do have to give proper attention to something. It's worth paying attention to something if you can act right then and there to improve the situation. Otherwise, it's not worth continuing to worry about or paying attention to it. Instead, it's better to shift your attention. If you wake up in the middle of the night and you're in pain, well, you can stretch or shift a little bit, and if the pain reduces, then great. Keep doing that until you solve the problem as best as you can. But at some point, you won't be able to help it anymore. At that point, continuing to wiggle, move, or worry about it only makes things worse. It's better to shift your attention and absorb yourself in something else, like the breathing, the warmth of the bed, reading a book, something that gets your mind away from the pain or discomfort that it's not helping to pay attention to anymore. I want to discuss a little bit more about the way we react to sensation and how that influences our experience of discomfort. The reaction you have to the event influences the experience of pain. The more physical reaction, like tensing against it, or emotional reaction, like becoming angry or depressed, the worse the pain actually will become. It's a vicious cycle, though. The pain or discomfort makes us stressed, but that distress directly influences the discomfort. Behavioral reactions can influence problems with social activities, sleep, exercise. If we're avoiding things socially and avoiding activity, then all that's left to focus on is the discomfort. So it's important to stay actively involved in a healthy lifestyle, even if we don't really feel like it because the pain and discomfort is bothering us so much. It's important to put yourself out there and try your best just to get your attention onto newer and other things. Lack of sleep is also a huge problem with pain. Pain reduces sleep, but reduced sleep also increases the sensation of pain, which then further reduces sleep, another vicious cycle. Improper methods to get to sleep and reduce pain can also make the discomfort even worse. Things like alcohol or antihistamines, using short-acting opiates, narcotics, tranquilizers, these things actually reduce our deep sleep, which will make the pain worse. So the more you employ good sleep hygiene, the more self-help methods you can use to control your pain, then the better your sleep will be, and therefore the lower the pain will be. So controlling your sleep in healthy ways can reduce the pain. Reducing your pain with good self-help methods can improve the sleep. And so that's a beneficial cycle. We've also learned a lot from sports medicine. Proper physical activity is very healthy for discomfort in general. For people that have just physical discomfort, headache, or physical pain due to nerve damage, then exercise can be extremely beneficial. And yes, you have discomfort and pain, so it's going to hurt a little bit more to exercise. But the more you exercise, the less the pain there will be over time. So it's worth exercising every day in a healthy way that you're able to do. That means spend as much time in preparation for a workout as in the workout itself, including warming up, stretching, and cooling down. Using supportive substances such as healthy eating or supplements, and avoiding inflammatory substances such as alcohol, caffeine, and sugars is also typically recommended, since those things can make it worse. Can pain ever be good? Well, yes, there's good pain and bad pain. You might wonder, how can pain ever be good? Well, if you've ever worked out or done athletics, then you know that some pain and discomfort is associated with exercise, and that's generally fine. If you get some burning and muscles get a little achy, and you feel a little bit strained the next day, that's fine. You learn how you feel the next day or what level is going to be optimal for you, and then you'll know that if you're just a little stiff the next day, that means you probably had a good workout. And you stretch and warm up a little, and that should go away. But if you have pain in your joints, or shooting pain down a limb, or going to spasm, for example, in your back, then those are signs of nerve damage or significant muscle damage, and that type of exercise should be avoided the next time you work out. It's important to use appropriate pain management techniques at different places. So what you do at home may be different than what you do at work. Being engaged in work activity is very important. You don't want to be constantly focusing on the pain, because that will just enhance the pain. But at the same time, you don't want to totally ignore it. Every so often, it's good to take stock and notice the discomfort. Is there something you can do to minimize the pain, like breathing exercises or gentle stretches, and to calm down your nervous system and reduce your stress, reducing the tension in your body? If the answer to that is yes, then it can be very helpful to take a stretch break and re-engage after you do these healthy relaxing exercise that we'll be introducing in a few minutes. When you're at home and there's not anything you have to necessarily be doing, then you may be able to spend more time doing these self-help exercises, or you may need to work harder to distract yourself and stay engaged in an activity like reading, stretching, doing the dishes, or something else that's better to get more fully absorbed in, so you don't just focus on the discomfort, since that makes the discomfort worse. So at home you do what you can to get as fully absorbed in things as possible, and taking what time you need to do some self-help exercises. At work, you may have to build in a certain schedule, for example 15 minutes twice a day, to do some stretching and breathing exercises. Probably the most important self-help method you can use is to control your attention. As we've been talking about, whatever you pay attention to, you enhance, and your body and mind gear up to support what you're paying attention to. So if you're focusing on the pain, that will fill your consciousness, and the discomfort will become much more increased. If a person says their discomfort is at about 50%, and they pay attention to their pain for about 5 minutes, their pain increases by much more, maybe up to 75–80%. If there's nothing else you can do to help your pain in that moment, it's better to get involved in something else. And then the pain can reduce by another 50% or so, sometimes much more. So by focusing on your pain, you can enhance the pain more, and that might help if you're trying to figure out what to do about it. But typically, you reach the point where you've done everything you can, and now you just need to shift your attention away from the pain and do something that's going to be more healthy and more effective for you. So again, it's important to note the sensation of discomfort, be aware of it, and engage in self-help activation to improve it, some sort of activity. But if there's nothing else you can do to improve the discomfort at that moment, then you notice it, let it be there in the distance, and then re-engage in what you're doing. Just like the exercise we did earlier, if it's during the day, you can engage yourself in work. If it's at night, you need to engage yourself in an activity like stretching, folding the clothes. If you're in bed, maybe fully absorbing yourself in the counting of your breath. Some sort of healthy activity that will let you focus your mind entirely and disengage from the nagging complaints of the pain. And that's really something you can do anytime, anywhere, even while driving a car. Those who have chronic pain tend to focus so much on the pain that it consumes most of their attention. One's life becomes organized around it, and it becomes a part of who they think they are. If you learn to have control over that part, then you are not your pain. You're just a person who has some pain from time to time. Try to learn to take control. For example, what can you do that makes it worse? What can you do that makes it better? How much does your reaction to the pain influence the pain sensation, and your pain sensation and suffering from it? As we talked about earlier, healthy sleep hygiene, regular healthy exercise, social engagement, mental clearing, calming exercises such as we do here, as well as things like yoga, tai chi, biofeedback, recreational sports, all these are very important for being able to manage pain and discomfort. They help you get your attention away from your somatic distress and toward interacting with the world. A combination of what you can do mentally and physically, along with medical support, allows the best response to medical intervention and ultimately the best quality of life for you. External support can be helpful, like working with your physician, getting physical therapy, chiropractic, acupuncture, biofeedback, many different things that are out there. Although we all need external support from time to time, we shouldn't get over-reliant on medication to help us in the long run. Although short-acting opiates can be useful for acute pain, they're usually not indicated for chronic pain. In fact, continuing to take short-acting pain medication in the long run can lead to actually worse pain and rebound and dependence on the medication, headaches, and lots of other complications. Internal skills can be learned from self-help classes like yoga classes, tai chi, many other things that can help with physical discomfort and pain. And there's a lot of resource you can get for self-help mechanisms at the Veterans Administration, community doctors, elsewhere. It's important to appreciate that even though you're trying to be more active and self-reliant, sometimes we do need to rely on others and have a more passive approach at first. If you need to get a massage every so often to relax your muscles, be able to relax your mind, or if you need to sit in a hot tub from time to time, that might be helpful. It lets you get over that hump and start engaging the self-help activities until eventually you're able to engage your own skills that are by far the most optimal pain management approach that exists.
For our final discomfort and pain exercise, we'll blend some of the things we've done previously. So first, with eyes open, ears open, skin aware, alert, notice what you see in front of you. Notice what you hear. Notice the sensations coming to your skin. You can become aware of these, but you don't have to react to them. Engage yourself in every detail of what you notice. Visually, colors, shape, patterns. Sounds, every texture of that sound, the various sounds around you. And the sensations against your skin, the pressure. And when your mind becomes pulled to notice some discomfort, allow that to occur. Notice the discomfort without reacting to it. But notice where it is, and also where it is not. Notice the location. Describe the sensations to yourself. Allow that sensation to be there without suppressing it, reacting against it in any way. Simply allow it to be there. And now notice what other, either neutral or comfortable sensations there are in your body, not too far away from that other uncomfortable area. Notice those sensations. Allow those sensations to be there as well. Allow these sensations to blend. They're both present. They're both present in the same area. Allow them to both be there together. And then as that continues to occur, bring your attention back to what you see, hear, and the sensations against your skin. Engage with these sensations as fully as possible. If it helps to feel as if you're breathing in what you see and hear and feel, and then giving your breath back to what you see, hear, and feel. And engage any way that helps you. Anytime your mind gets pulled back to distressful thoughts or feelings, go ahead and recognize those. Describe them. Don't get caught up by them. Don't react to them. Simply describe them. And then shift your attention to other internal feelings that are more comfortable. They're both there together. And then bring your attention back to what you see, hear, and feel in the environment. And engage as fully as possible. In this way, you can start to control your attention and also learn not to react to discomfort and also not to get too overwhelmed by it. There's discomfort, but that's not the whole of your existence. That's just one aspect. You can notice it, allow it to be there. Notice what else is there as well. That's more comfortable. They are both there together. And then shift your attention back to engaging in the environment. If you can practice this sitting, then it'll be much easier to do when you're actually walking or driving or engaged in some active activity. The same thing when you're working at the computer, or when you're doing some exercise, some activity. If you get distracted by the discomfort, just pause for a moment. Recognize it, don't react to it. Label it, describe it. Notice what other positive sensations are there, or at least neutral. Notice they're both there together. And then re-engage in the environment.